Welcome to the Functional Relations Podcast, where we set aside time to have engaging conversation. I had to swallow halfway through.
Yeah, man. Just take a deep breath before, so you're gonna.
Okay. Welcome to the Functional Relations Podcast, where we set aside time to have engaging conversations on relevant topics related to behavior analysis. I'm Zachary Bird.
And I'm Caleb Davis. Welcome, Zach.
Oh, thank you.
Welcome to your own podcast. I'm happy to see you.
Thank you. Yes, I'm happy you're here too. How's it been going?
I'm doing good. I actually just started a vacation, so I'm doing great.
Oh, I'm jealous. That's good. I've been, just working, but I'm glad to hear, I'm not jealous at all. I'm glad to hear that you're got a week-long vacation.
Yeah, it's pretty good. I'm going to try to enjoy my time, get some, fun time summer vacation activities in. It's not all sunshine and rainbows, though, the whole vacation life. No.
Why?
Well, I love going on vacation, but I hate coming back from vacation. It's the worst.
Yeah. It's like the day before you have to go back. You get that feeling,
Sunday afternoon leads to Sunday evening, and then it's like all you can think about is the upcoming work day, and maybe that's a little stressful sometimes.
Yeah.
I don't know if you've ever experienced that.
Oh, I can relate. I mean, that's actually kind of an interesting topic because you get that feeling in your stomach, that I think we might call it like anxiety or anticipation or something about that.
For me, it's maybe a combination of different emotions, right? Depending on like how you want to categorize it. There might be, in my case, a little bit of sadness. My vacation's coming to an end.
Yeah,
At the same time, maybe it's a little bit stressful, or like there's a little anxiety about thinking about what my Monday morning might look like.
Right. You kind of start to organize.
Yeah.
You're kind of running through your calendar and thinking about how you're going to manage that. I can relate.
Yeah. So there's, a number of emotions that those kind of transitions, I think, can cause. But yeah, you're right. I think emotion in general is an interesting topic, especially if, you think behavior analytically about it.
Yeah. I think using our conceptual framework in behavior analysis to understand and to explain emotion is something that has, maybe some people know, maybe some people don't, but this has been done for a long time.
Emotion is relevant. It's super relevant in our everyday lives, even comes into play when we're working with clients. But I think that the way we talk about emotion is important, because I certainly think that I've heard people talk about emotions in a way that maybe isn't always that helpful.
Right,
so for example, it's not all that uncommon to kind of use circular reasoning when talking about emotion. For example, I've talked to my supervisees in the past about some of the tricky parts about talking about emotion is that people often talk about emotion as it causing other types of behavior. So I don't know, have you ever come across that?
Yeah, I think when we think of it as causes, it leads us down a path where we still have explaining to do.
Yeah, I don't know, because you do a lot of assessments as part of your work, if when doing things like FBAs and stuff, do you often see people kind of attributing behavior to some emotional causation?
Yeah, I think that there's kind of a simple solution to it, which is I've just learned to say, okay, well, what causes the frustration? So if someone's like, well, he always starts hitting when he's frustrated. It's like, all right, well, what causes him to be frustrated? And then usually they answer the question. So it's like, it can be a circular reasoning issue. It can also be like this mediating event issue, which is that they understand that toothbrushing causes frustration. And the way they understand it is that frustration causes the screaming. So there's this frustration has to be this mediating event where behavior analysts might just say, yeah, It just seems that toothbrushing causes screaming.
Right. So along the same lines of that, I think I'll call it sort of like a special case of emotion, and one that's really commonly talked about is anxiety, right? Like this is a very common thing that I've encountered where people often cite anxiety as a cause of behavior.
Yes, that's right. Someone might ask you, Caleb, Sunday night, and you're just not behaving normally. You just seem kind of out of it. What's wrong?
Right, and I could say, "Oh yeah, I'm feeling kind of anxious about my work day tomorrow. I've been on vacation, so I'm kind of anticipating going back to work." But I think that rather than thinking about it in terms of like my anxiety is causing me to act in a way that somebody's like pointing it out to me, it's really that is my anxiety. Like my anxiety actually is behavior, right? It's what
Right.
people are
Yeah.
seeing.
Right.
And the cause of that behavior, the functional relation there is
Functional relation.
functional relations.
Good term. Good phrase.
Yeah.
I like that. It's got a nice ring to it.
It's great. Yeah. We should drop it more often. Actually, I feel like we do. But
I think we do it all the time. Yeah.
But yeah, so actually what's functionally related to that behavior that we sort of we term anxiety is that transition back to work, right? It's that context, it's that event. And so I think that that's a helpful way of thinking about it, right? Is like what are the variables that are attributing to this behavior that we often term or tact as anxiety.
Yeah. One thing that I came across just recently, because I got this book by Peter Sturmey. He's the editor and has a bunch of different chapters in it. And one of them is written by Pat Friman and colleagues. It is about anxiety. And that was the first time I noticed that. I guess I had kind of known this in the back of my mind, but when they mentioned it, they said that 40% of individuals with a diagnosis of autism actually struggle with clinically significant levels of anxiety. And I hadn't noticed that before, and I hadn't thought about that before. Did you know that?
No, I didn't know the exact percentages that you just described, but I mean, I think that, in my experience, like working with individuals diagnosed with autism or working with like, families or other clinicians and stuff like that, I often hear people talk about this as being like a common issue. So I think that it makes sense to me when you say it. Like when I hear that 40%, I'm like, oh yeah, actually that makes a lot of sense. What's interesting though is I know it's something that's often talked about, but I feel like the issue of anxiety hasn't really been tackled a lot by behavior analysts, right?
The first time I had really given it any thought, it was in grad school. I'd been given this paper by Pat Friman called "Why Behavior Analysts Should Study Emotion."
Pat Friman gave you the paper in person?
Yeah. Yes.
Wow.
Thank you, Pat, for hand delivering that article that you wrote. That was really useful. And so this was the first time I was introduced to it, and I thought that's really interesting because I feel like there's so many kind of rumors around anxiety and how behavior analysts don't believe in emotion or they don't believe in anxiety or whatever. And this kind of was like, oh, well, that's just not true. And we can do things to help folks with anxiety. I know that people who are, very verbal and have a lot of skills, often things like ACT is often used for that sort of population with anxiety. But, I think that it could also be useful for us to understand a little bit more about what are the things we can do with folks who maybe have that verbal skill set, but maybe don't have a verbal repertoire that would allow you to do kind of the CBT or ACT sorts of verbal type therapies.
Similarly, when I was in grad school, I read about emotion from Skinner in Science and Human Behavior, where he kind of like, gives like a conceptual overview of anxiety and like just emotion in general, which for me was really helpful in sort of shaping the way I think about anxiety and how it relates to behavior. But the thing that I don't think I've seen that much of is how do we take that and translate it into clinical practice, right?
Right.
So I think like conceptually, yeah, it makes a ton of sense, like how emotion is tied to behavior and how it is behavior. But then, yeah, again, how do we take that information and make some valuable contribution to like make some socially significant changes for clients?
Yeah, I think that's right. And I'm not trained in ACT, but I know that that's therapy that can be used for folks with a strong verbal repertoire. A lot of times I'm working with folks who don't have a strong verbal repertoire and who still have anxiety. And so I'm thinking we should really delve into what strategies we can use that might benefit those folks as well.
Yeah, absolutely. And I think that it would be really helpful to have some strategies or ways of assessing or talking to somebody that can tell us, is this something we can even treat, right? Because I think oftentimes what I've seen is we talk about anxiety as something that maybe is a little outside of our scope of practice. But again, I'd like to know if that's true or not. Maybe there's more we can do to, help assess and treat anxiety in clients. Because you already talked about like how prevalent it is. It's there. We're encountering it all the time. It's just a matter of like figuring out what we can do to help.
Yeah, I think that's right. Hey, so let's go find someone that has some experience in this area and let's chat with them.
Sounds good. Let's do it.
Okay, let's do it.
Dr. Keira Moore, welcome back to the Functional Relations Podcast. How are you doing today?
I'm good. Thanks for having me back.
Dr. Keira Moore is the founder of Moore Behavioral Consulting and an adjunct faculty member at Regis College in the online program.
So today we're talking about anxiety and autism. And this is something we know you know something about, so we're really happy you could join us today. To get started, do you think you could give our listeners a definition of anxiety, maybe a behavior analytic definition of anxiety?
Sure. Whenever I'm talking about anxiety, I always sort of preface it with it's good to understand how sort of lay people and other psychologists treat anxiety and understand anxiety and define it, and then to try and take that conceptualization of anxiety and make it a behavioral conceptualization. So generally speaking, most of psychology and most people kind of just in their day-to-day lives treat anxiety as something that people have rather than something that people do. So I think another way to say that is anxiety is treated as this sort of like mystical thing inside of us that causes us to act a certain way. And it's generally viewed sort of as a private event that causes behavior. And then we also sometimes talk about physiological responses. So those are things like sweating, shaking, increased heart rate, butterflies in the stomach, all the things that we normally feel when we're anxious. And now as behavior analysts, we all know from our good friend B.F. Skinner that kind of conceptualization of private events causing behavior doesn't really help us in our science. So if we're thinking about anxiety as this thing that we have inside of us that's sort of a private event that causes behavior, it's not really going to get us anywhere. Anxiety is not this sort of invisible force inside us that makes us behave or act a certain way. So I like to talk about anxiety as something that people do and as behavior. So we have to, I think, be really careful to sort of avoid that dualistic view of anxiety as this thing inside of us that causes us behavior, and instead look at our interactions with the environment just like we would with any other kind of behavior. So for my purposes for my dissertation research, when I was studying anxiety, we tried to figure out how can we better define anxiety as behavior. And this is totally not an original definition from me. This is pieced together from a lot of other behavior analysts that have done great work in this area. But we settled on defining anxiety as a cluster of responses that can include both operant and respondent behavior. And those responses might be public, they might be private, or they might be both. And the important thing to consider when we're talking about anxiety is the context in which those behaviors occur. And that context is specifically when we have an upcoming aversive event that's signaled. So we're talking about a whole big cluster of behavior. It can be operant, it can be respondent, it can be public, it can be private. It might be one response, it might be 20 different responses or 20 different things happening. But the important part is the context or the environment in which it's happening. So it's always going to be when there is something aversive that is signaled and forthcoming.
So this might be kind of separate from what people might talk about generalized anxiety disorder or something like that.
Yeah, so I think that generalized anxiety disorder is similar in that it is those same ideas of its behavior. It might be respondent, it might be operant. I think generalized anxiety disorder probably has more of a respondent conditioning component. And what happens basically in generalized anxiety disorders is you don't start out anxious all the time, right? You start out with like maybe one or two things start causing this kind of behavior or these kind of elicited responses. And then through the process of conditioning, through respondent conditioning and generalization and equivalence, we get all of these other stimuli that start to signal bad things happening, and then we start to behave to all of these different stimuli. So when we have generalized anxiety, it's basically just those processes of equivalence and generalization that are working overtime and making us sort of think everything is a signal for danger.
One thing I really liked about what you said was you kind of have been able to think about it in kind of a functional way, that it's just like other types of behavior. There are things that might trigger it. There might be consequences that are coming into play as well. Can you give us some common examples and think about it in kind of our antecedent behavior consequence format and how anxiety might come out of that?
Yeah, so a sort of classic example that I use sometimes just even in helping to sort of figure out how do we talk about anxiety in a behavioral way versus the way we traditionally think about anxiety and talk about. A former student of mine, we'll call him Johnny for the purposes of this, he really didn't like loud, chaotic environments, as many children with autism don't. And we noticed that with this particular student around like 11 o'clock every day, right before it was time for him to go to the cafeteria, which you guys both worked at the New England Center for Children with me, you know how loud and chaotic that cafeteria gets.
Yeah,
It is.
This guy had an 11:30 lunchtime. Now, this guy couldn't tell time, but he was pretty savvy with his schedule, and he knew what came next throughout the day. So we noticed around 11 every day that he sort of would start tensing up. Sometimes he'd start covering his ears. He'd pace around the room, and he would engage in a lot of perseverative speech about the cafeteria. So he'd be asking, is it time for lunch? When are we going to lunch? Are we going to lunch now? What's for lunch? Just a whole bunch of different questions about lunch. So I think to any casual observer or anybody that didn't even know him, they could look at that behavior and see him and tact that he appears anxious, right? And I would agree with that statement. It's pretty easy to look at somebody that's kind of pacing around and tense and talking about something and wringing their hands and say like, oh yeah, that person, that's anxiety right there. The problem gets into where most people would say that anxiety is causing that behavior that we see. So anxiety is causing him to be tense. It's causing him to pace around. It's causing him to perseverate over lunch. So that's where we kind of get into that tricky dualistic view of anxiety, where we need to take a step back and go, wait a minute. It's not anxiety that's causing that behavior. It's this situation that's presenting itself that's causing that behavior, and that behavior is anxiety. That's how anxiety is coming out for this guy. We can call that cluster of responses anxiety. Just like we could call aggression and crying and screaming all as a cluster, we could call that a tantrum, right? So anxiety is just sort of a name for a cluster of behavior. So for this guy, it's that environment that's being set up. There's a lot of signals happening that are signaling to him that it's about time to go to the cafeteria. Going to the cafeteria is really aversive for him because he doesn't like loud noise. He doesn't like chaotic environments. So as there's more and more signals that lunchtime's coming and you're going to have to go do this aversive thing, we see the anxiety kind of ramping up. So it's not anxiety causing behavior. It's the environmental conditions signaling that this aversive thing is coming that's causing that behavior that we call anxiety. So it's really important when we're talking about anxiety to look at that environmental context and say, okay, is there something aversive that is happening in this person's environment? And then what are the things that are signaling that aversive event's about to happen? Because if they don't know that it's coming, you're probably not going to see a lot of anxiety. If somebody just like surprise
Right.
lights off a firework next to you, you're not going to be like freaking out about it all day. It's going to happen and you're going to have a reaction. But anxiety happens when we know or when we think something bad is about to happen. In this case, I think the reinforcers are a little bit less relevant in this case, but of course we wouldn't know unless we do a full assessment of that. But likely that behavior for that particular child wasn't socially maintained. So all of the anxiety that he's engaging in, he's not necessarily getting attention for it. We had a pretty strict behavior plan with him where you didn't attend to those kinds of things because we weren't really sure what was going on. So we'd kind of just ignore that behavior and try and redirect him to whatever he was doing. There wasn't an escape component. If he engaged in all that anxious behavior, we weren't saying, okay, you don't have to go to lunch. He still had to go to lunch every day. So it's likely that was automatically maintained, and we can get into that a little bit more. It gets a bit complicated when you're trying to figure out all the maintaining variables there. But that's sort of the general kind of way that I conceptualize anxiety is we have to look to the environment, figure out what are the signals, what are the aversive events, and then we can also kind of delve into the consequences as well.
Yeah, it's a really helpful example. And so when those signals that are, signaling that in this example, lunch is coming, would you say that those are conditioned stimuli and they're then eliciting some like that anxious behavior? Is that accurate?
Yeah, exactly. Yeah, so there's quite a bit of respondent conditioning that takes place, I think, with most anxiety. Sometimes it can also just be straight up regular old operant conditioning, and those are just regular old discriminative stimuli and establishing operations, especially in cases where we do have some social reinforcement going on. So there's a lot of cases where you'll see anxious behavior that's reinforced by escape or avoidance, that if somebody's behaving in such a way to indicate that they really don't want this thing to happen, then sometimes we do our best to make sure that thing doesn't happen, right?
Yeah, absolutely.
Yeah, that makes sense. Would that be an example where you'd have like this respondent operant interaction where it's like there might be some conditioned stimuli that are eliciting this respondent behavior, and then maybe at the same time you're engaging in some escape behavior because that's an unpleasant context? Would that be a good sort of description of that?
Yeah, exactly. I think that's the complicated thing with anxiety is we have to think about all of those different layers that might be going on, that we might have some respondent conditioning happening. More than likely we do in most instances of anxiety, but we might also have some operant conditioning at play. We might have public behavior that's happening. We might also have private events that are happening. And sometimes if we have a higher functioning kid that can tact those things and say like, oh, my belly hurts, or, oh, I feel however, then we might kind of get at some of those private events as well. But more often than not, I think with kids with autism, we don't know. So anxiety is complicated because it's this big cluster and it can include all of these different things you have to take into account: operant conditioning, respondent conditioning, all the different layers that are happening and all the different behavior that's happening.
Yeah, it certainly sounds complex. In your experience, given that there's like this cluster of behavior, some of it might be public, some might be private, have you found or come across good ways of measuring that? Like, how do we measure anxiety given its complexity?
I think you have to treat it just like any other behavior and any other behavior problem that you're dealing with. So we have to first observe the behavior, and then we need to be able to operationally define any observable behavior that we're seeing. As far as private events and sort of like physiological responses that we talk about with anxiety a lot, in my own practice and my own research, I have not had great luck being able to measure those things. That being said, when I was conducting my research on anxiety, that started almost 10 years ago, and the technology that was available even 10 years ago is totally different than what's available now. So I think there's been some other researchers having a lot more success in measuring physiological responses, where I didn't. We had tried some like sweat measurements. We had I forget what it was even called, this band that went around kids' ankles and was supposed to measure sweat output, which should be a good physiological measure of anxiety. We also tried to use heart rate bands. This was back before they had all the excellent smart watches and stuff where you can do that a little easier. We were trying to strap heart rate bands on kids and try to see like what can we measure that we might not normally be able to see, so that we can include those things as well. But in my experience, we were never able to get very good data from those things, probably because most kids with autism, when you go and strap a heart rate monitor on them that they've never seen before, that alone stresses them out, and they're messing with it the whole time.
Right.
And it never worked out. But there are a lot better ways to measure that kind of stuff now. But I would say for the most part, any observable behavior, you can just operationally define that and measure it just like you would any other behavior. It's important with anxiety that you're looking at the full cluster of responses, and you're considering all the different options and all the different things that might be part of that anxiety cluster, and measuring everything and defining individual topographies of behavior that are happening. And then, of course, if you can also get measures of things that are more private events like heart rate or sweating or blood pressure or whatever it may be, that's icing on the cake. But I think for the most part, you can still do some good work in anxiety without measuring that stuff.
Yeah, because, oftentimes people might see folks who are having a difficult time and they will say, oh, yeah, he's very anxious right now. Whatever they're looking at is what you should be measuring, right? So the fact that
Exactly,
he's anxious right now, that tells you that something you're observing is letting you know that. So that's something to.
Yeah, there is one caveat with that, and one thing that I always like to caution people when they're working with children with autism is don't assume something is anxiety because it looks like the way you or I might behave if we were anxious. So, for example, we see kids with autism engage in a lot of what looks like OCD type behavior. And OCD, by definition, in psychology, it has an anxiety component. So people engage in obsessive and compulsive behavior to sort of deal with anxiety. And of course, there's some issues with definition there, with dualism there. But we have to be careful with kids with autism. A lot of times they engage in those same types of behavior, but it may not be due to anxiety, or it may not be, I shouldn't say due to anxiety because that makes it sound like anxiety is causing it, but it may not be an expression of anxiety. It may be that they just enjoy doing those things. That's part of the autism diagnosis, right? That they engage in repetitive and ritualistic behavior. But engaging in repetitive and ritualistic behavior doesn't necessarily mean it's anxiety. It might just be like stereotypy, where they enjoy lining things up, and that brings them some sort of reinforcement, and they're doing that for that reason, and it's sort of automatic positive reinforcement. So we have to remember to go back and look at the environment and say, okay, when are these things happening? Are they consistently happening in cases where there is some kind of aversive event that's forthcoming? Or are they just kind of happening across the board? Does the person look distressed when they're doing them? What happens when we interrupt it? There's a lot of things that you have to kind of consider. You can't just look at topography of behavior and assume that it's anxiety because it looks like it.
Yeah, that makes sense.
That's a good point. And that's pretty much like any behavior that we would deal with as behavior analysts, right? We wouldn't want to assume function just based off topography alone. So it sounds like, the behavior we're labeling as anxiety is no different.
Yeah, exactly. And I see that quite a bit in individuals on the autism spectrum, where somebody will say like, hey, can you look at this? This kid has a ton of anxiety and we don't really know what to do with it. And it's a kid that's engaging in repetitive and ritualistic behavior of like tapping different things or lining things up or going through this whole complicated pattern of steps when they walk. And when you look at it and you see it across the day, and the person doesn't seem to be otherwise distressed or agitated, and there's nothing necessarily aversive going on in their environment, I wouldn't consider that anxiety. I would say that's probably more akin to something like stereotypy, where they're engaging in this behavior because there's some automatic positive reinforcement for them. And we need to treat it a little bit differently than we treat anxiety. So you have to remember anxiety is specific to that context where there's something aversive being signaled and forthcoming. And then you also have to remember sometimes we see with kids with autism, sometimes they engage in behavior that we might want to label as anxiety that we might not have otherwise. So an example of that is the same cafeteria incident. I had another student that every day as soon as he came into school, he was checking the lunch menu, and he was talking about lunch all day and asking what was for lunch. And he seemed like he didn't seem like upset about it. He didn't seem distressed about it. He was just asking a lot. And he was a kid that, didn't really seem to be bothered by it too much or didn't seem too anxious. Yeah. And so he also liked to eat. And we were like, oh, he must just be hungry. Maybe he didn't eat breakfast. Like, he's so obsessed with the lunch menu just because he likes lunch, because there's no work involved in lunch, and like whatever. He's just excited to go to lunch. So that's based on the topography of that behavior. We labeled that as excitement. Come to find out, pretty soon he was incessantly checking the lunch menu because he has this weird fear of rice. And we're kind of trying to figure out what's going on. We talked to his mom, and she said, is there rice being served at lunch on these days that he's doing that? And we were like, I don't know. Let me get copies of the lunch menus and go back and look. And sure enough, it's 100% correspondence between when he's biting and when there's rice on the menu. So there's behavior going on where he's repeatedly asking about something, and it makes it seem almost like he's excited, but that actually could have been a measure of anxiety, that he's actually really stressing out about there being rice on the floor and having to go up there. So sometimes it can be hard. We have other cases where we have kids that just have this sort of deer in the headlights reaction to stress or anxiety, where they just freeze or they stop engaging in ongoing behavior. I had a student that really was sensitive to loud noise, and in particular to another student that was one classroom away. And he could pick up on when the student was coming or was nearby well before any of us could. I think he was a bit more sensitive to the sounds that this other student was making. And when that student was up out of his room and starting to approach this other student's classroom, he would just freeze. And it literally looked like someone had just pushed the pause button on him. Like, he'd freeze with his hands up in the air. His whole body would tense up. He would stop responding to teachers. He'd stop responding to everything. And for a while, we thought he was having some sort of seizures or something. And it took us a while to figure out, like, oh, he's actually just responding to this other person's noise that he's really not happy with. And it's sort of this deer in the headlights type response. So anxiety can present in a lot of different ways, which is where we have to be really careful, again, to go back and look at the environmental circumstances that are happening.
Yeah, that makes sense. Hey, sorry to interrupt, but if you're a BCBA or a BCABA and interested in getting a CE for listening to this episode, you can purchase it at functionalrelationspodcast.com. This episode is worth one learning CE, and you'll need to provide 2 code words when you go to check out. The first code word for this episode is cube. Not a pyramid, not a cylinder, but a cube. C-U-B-E. Cube. Traditionally, it seems like a lot of times this is up for psychologists to analyze and psychologists to assess and treat. But I'm just going to ask you, can behavior analysts treat anxiety?
I hope so.
Yeah, me too.
Otherwise, I wasted a lot of time in my dissertation. Yeah, I think anything that's behavior, we should be able to treat, right? I think anxiety is an area that is understudied in behavior analysis, and I hope will gain more traction in research and in practice. I think because of the way we conceptualize anxiety as this sort of thing inside of us that causes behavior, it makes people think that it is not something that behavior analysts can tackle. But if you get away from that sort of dualistic view and remember anxiety actually is behavior and it is caused by the environment, there's no reason then why behavior analysts shouldn't be able to tackle that. I think things like generalized anxiety, where you have people that are just anxious all the time and experiencing a lot of physiological responses and things like that, is a little more difficult for most of us that have the type of training in behavior analysis that we all do, which is geared more towards applied behavior analysis for children with autism. But there's actually quite a bit of really good research going on in that arena in ACT and some relational frame theory stuff. Not my area of expertise. And for me, whenever I try to delve into that research, I find it really confusing because it has a lot of different terminology, but it's the same basic concepts. They're doing some really great work. They've had some really great treatment results. The data that's coming out of a lot of the ACT work is great. And I've always said if I was ever struggling with anxiety, I would want to see somebody that's trained in ACT because they know what they're doing.
Yeah, that makes sense. That's good. So what type of assessment methods can a behavior analyst use to treat the type of anxiety that we've been discussing?
So there's two general things that I usually recommend. One is an antecedent analysis to see what things elicit or evoke anxious behavior. So that's where we were talking about the signals that are signaling an aversive event. So that's where we're looking at what are those signals and what are those aversive events. And then also a functional or consequence analysis if you have reason to believe that anxious behavior may be socially maintained. But I think we don't always need this in all cases. I've definitely seen cases where we do an antecedent analysis and look at what is eliciting or evoking anxiety. And then when we look a little closer, we go, okay, but I think that behavior then might be being reinforced by attention, or it might be being reinforced by actually escaping the aversive event. So let's look into that a little bit more and see if we can do a little consequence manipulation and get that behavior in check. So I think you need to always start with an antecedent analysis just to see what are the conditions in which we're seeing anxiety and to be able to get a good baseline measurement of it and get good operational definitions.
So it sounds like basically you can, the two main ways that you've assessed anxiety is you've used the antecedent analysis, and then if a functional analysis is needed, that's a possibility too. Is that right?
Yeah, so if we were seeing anxious behavior happening in that antecedent analysis, but we had reason to believe that maybe it's attention maintained or maybe it's escape maintained, and we want to try and get at that reinforcing consequence in our treatment, then we might do that as well. Again, in a lot of cases, we didn't need to go there. A lot of times we know that behavior might be escape or avoidance. Right. It's a little bit less likely that it's attention maintained and that's the only thing that we need to focus on. Really, when kids are engaging in anxious behavior in a situation where they know something bad is about to happen, it makes sense, right? Like
absolutely, yeah.
Of course, like I engage in anxious behavior when something bad is going to happen. But the important thing for kids with autism is a lot of things that they routinely have to deal with lead to a lot of anxious behavior. So things like going to the dentist or going to the doctor or getting a haircut or getting nails cut or being somewhere where there's loud noise or being somewhere where there's a lot of people. Some of those things are things that are going to happen to them every day, and they have to learn how to handle those things because there's no getting out of those things. So that's where doing those kinds of assessments and then overlaying treatment on top of it can be helpful, because it's okay that they're anxious with those things, but we want to give them better ways to handle that and make sure that they can still experience all the things that they need to experience in their lives. I talk about a lot, we have to also be careful when we're assessing anxiety and preparing for treatment to really consider whether treatment's necessary or whether there are things that even young children should be allowed to request or communicate appropriately that they want to escape or avoid. So for for instance, I had a 21-year-old student that really didn't like birthday parties, and it was a huge source of stress for her. There was a ton of anxious behavior leading up to birthday parties, and the staff wanted to include her in my dissertation and said, like, this is a big problem. She's engaging in all this anxious behavior. Sometimes she just won't come to school at all when she knows it's a birthday. There's birthdays all the time. Like, we have to deal with this. And I said, okay, she's 21. If she doesn't like birthday parties and doesn't want to go to them, it's appropriate for a 21-year-old to be able to say, you know what, I don't really like doing that.
Absolutely.
Give her a way to request to not go to those, and give her some kind of other response that's appropriate. Like, hey, it's cool if you don't want to go to a birthday party, but it would be nice if you made that person a card, or if you go see them earlier in the day and say, hey, happy birthday, can't come to your party because I got something else to do, and teach her appropriate behavior around that. But in that case, totally okay to escape and avoid those things. We don't need to treat the anxiety for that. We need to just teach her a better way to deal with that whole situation. I don't like birthday parties either. Sometimes they're really annoying, but I have the skills to navigate that for myself, and this particular person didn't. So it was, in that case, it wasn't worth going through this whole assessment. It was worth just looking at the whole situation and going, no, you know what, that's okay.
That's a great point.
In cases of like haircuts and things like that, kids have to get their hair cut. Kids have to go to the doctor. So those are the cases where we want to go, okay, they can't escape or avoid these things. We got to do something better, and we got to help them deal with that anxious behavior.
If the determination is then made that you need to move to treatment, what does that look like? What are some examples of common treatments that are out there, or behavior analytic treatments, I should say, for treating anxiety?
So I think the important thing is, when it comes to treatment, it should be individualized, and it should depend on your assessment. And generally speaking, I think the goals should always be, first, teach communication to appropriately escape or avoid that thing. Regardless of whether it's something we want them to escape or avoid, we should always make sure they have those responses in their repertoire first. So even if it's something like going to the doctors that's really, really anxiety provoking, kids have to go to the doctor. They have to tolerate that. But before we teach them to tolerate that, it's important to teach them how to escape or avoid that, because there might be times they can opt out of certain things, and those are really good skills to have. So why not use a super powerful reinforcer to teach that? If we know escaping the doctor is a really powerful reinforcer, let's use that to our benefit first, and teach them how to say, no, I don't want to do that, appropriately, without engaging in problem behavior. So that's, for me, that's step one of every treatment, is teaching appropriate escape and avoidance if they don't already have that. If they do already have that, or we have already taught that, then the next step is teaching appropriate alternative behavior when escape isn't an option. So when they do have to go to the doctor, or they have to get a haircut, or they have to get their nails clipped, we have to teach appropriate behavior in that situation. And that means appropriate behavior before it, when they're engaging in all this anxious behavior, and then appropriate behavior during it. So I like to do that by fading in the aversive stimulus really slowly, and also occasionally continuing to reinforce appropriate communication so that that doesn't go away completely. And then by teaching alternative behavior to whatever their anxious behavior is. Okay, so you have to then look at the topographies of anxiety and teach alternative behavior to that, or incompatible behavior to that. So if you have kids that are pacing around the room and engaging in hand wringing and things like that, we might teach them how to sit down in a chair and count backwards from 10 and take deep breaths and squeeze the therapy ball, and all the kinds of relaxation things that we would teach any other adult that's dealing with anxiety. So we teach them other behavior to engage in when they're kind of stressing out beforehand. And then we also slowly fade in the aversive event. So if it's something like going to the doctor, we might say step one is just, we're going to practice that relaxed behavior while we're waiting. And then when we have to go, you're going to engage in just this one little thing, and then you get to escape. So if you can go in and just walk into the waiting room, sit down in the chair for 10 seconds and engage in your relaxed behavior, then you get to go and leave. So it's basically like counter conditioning and taking all that behavior that's already happening changing that to something different and then fading in that aversive stimulus and teaching them how to be calm and relaxed in those situations, and teaching that if you are calm and relaxed in this situation, then you get to escape, not the other way around of like freak out and lose your mind and we're going to let you escape because we can't do this thing anyway.
Oh, I like that. That's really smart.
So that's sort of the general procedure that I always follow. It you may have noticed there's some parallels with Greg Hanley's work in functional analysis and treatment, and how they do the treatment of like you teach a simple communication response first, and then you teach them what to do when that response doesn't work. So it's that same sort of idea. We got to get the communication there first, but then we also have to teach, okay, when you communicate and say, I don't want to go to the doctor, and I say, well, you got to go, then this is how we deal with those situations.
Yeah. So it kind of comes down to first teaching alternative behavior about how to get out of the situation, then introducing the aversive event slowly in like a desensitization sort of program. And then also keeping in mind that when we end the desense step, we want a relaxed state before ending it, instead of ending it in a frantic anxiety.
Exactly.
That makes sense. I like that. That's a good sequence.
Yeah, I think that's sort of, for a lot of kids with autism, we sort of build that behavior up, right? When they go to the doctor and they're struggling and they're anxious and they're engaging in a lot of challenging behavior, oftentimes those exams or those visits end early, or they end unsuccessfully because we have to get them out at some point. We have to stop at some point if they're not cooperative. So this is sort of reversing that and doing sort of counter conditioning. And that comes out of some really good animal work. Jesus Rosales Ruiz
he's amazing.
I think it's the University of North Texas. Yeah, he's got some really awesome animal work where they do basically the same kind of procedure. There's a lot of work done with dogs that's really similar, of like dogs that are afraid of strangers, where you basically walk the stranger as close as you can, and when the dog is engaging in like barking or aggressive behavior, you just wait them out, and as soon as they calm down and they're being appropriate, then the stranger leaves. And then the next time they come back and they come in a half a step closer, and same thing, you wait for that calm, cool, collected behavior, and then they leave. So you're basically still giving them escape, and you're still giving them that reinforcer that they want, but you're reinforcing appropriate behavior. Same
I've been
idea
working on
here.
that with my dog in the park recently, actually, because of this exact treatment that you're talking about. It is really cool.
Take a look at that. The stuff from Jesus Rosales Ruiz. He's got some really cool research in that whole group,
or something like that.
Yeah, they call it cat training. I can't remember.
Cat training with dogs. Is that right?
Yeah. So if you look up cat training for dogs, I think initially they were doing it with horses.
That's right. Yeah.
And I can't remember now what CAT stands for, but that's
aggression
kind of what I was thinking. Yeah.
We'll put it in the show notes for people. That's
There's
cool.
some really cool videos that they have too.
So it's based on that. That's really cool. I like that.
Yeah, same general ideas.
Yeah, for our listeners that are maybe hearing you talk about anxiety as it relates to autism, and they're maybe interested in learning more about it, why do you think why should more behavior analysts learn about treating anxiety with their clients? I guess that's a big question.
Yeah, I think one reason is anxious behavior is super prevalent in kids with autism. I've read estimates anywhere between 40 to 80% of children with autism also having anxiety or also qualifying for anxiety disorder diagnoses. I think that those numbers may be a bit artificially inflated because of what we talked about before, where a lot of behavior that looks like anxiety may not actually be anxiety. It may be more stereotypic, like behavior where they're just getting enjoyment out of doing different repetitive and ritualistic behavior. But I still think that anxiety is a big problem in this particular group, and I think it comes down to there's a lot of aversive things that all of us have to do in our everyday life, right? We have to go to the dentist. We have to go to the doctor. We have to get haircuts. We have to get our nails clipped. We have to shower every day. We have to do work that we don't want to do. for a lot of higher functioning individuals, it's easy to understand why we have to do those things or what's happening around those things. So like when I go to the dentist, I hate going to the dentist, and there's a lot of loud noise and there's a lot of scary things, and there's the discomfort of somebody sticking their hands in their mouth or asking you a question while they've got tools in their mouth. But I can sort of think about the reasons for those things, and I understand the benefit of why I'm going there, and I can kind of weigh out those things and go, yeah, okay, I have to go to the dentist. I have to participate in this thing that is aversive to me. For kids with autism that don't have that higher level reasoning or higher level understanding of the whole situation, you can understand why things like that are so much more aversive to them and so much more difficult for them to want to participate in. They don't understand what all those loud noises are. They don't understand why this strange man is sticking his hand in their mouth, or why they're uncomfortable. And it's sort of extra scary when you're in that situation, but you don't understand why it's happening. So I think as a whole, we can expect people on the autism spectrum to experience more anxiety just because they're going to come up against all of these same aversive things that we do, but they may not understand what's going on, or they may not understand why they have to do those things. So I think for just because we want to be good, ethical, humane practitioners, it's really important to pay attention to those things and not just go like, oh yeah, well, of course he's afraid of the dentist, he's just going to have to suck it up and go, and well, let's just put him in a papoose and stick a bite block in there and do what we have to do, or let's just drug him and he'll be fine. It's the humane thing to do to treat people with a little bit more dignity and respect than that, and teach them how to escape those things, and then teach them how to handle them better, the same way you or I would want to be treated in that situation.
Yeah, very good. I love the way you put that about being ethical, being understanding where someone's coming from, and try to help them out if we can. So if people are interested in more of your work in this area, I hear you have some webinars that might be of use to people. Can you tell us a little bit about that?
Yeah, so I'm in the process of scheduling out a few other things for August and September, where I'll do some smaller group webinars that I'll host myself. And then I'm pretty regularly doing webinars on sleep and on anxiety with BDS. We've been offering those about once every 2 or 3 months. It's the same webinar. We're just offering it multiple times because there's been a pretty good need for that. But if people are interested in learning more about anxiety or knowing about upcoming webinars, they can join my email list by either emailing me or visiting my website. And there's a contact me button on there. Unfortunately, I don't have it automated yet where they can just hit a button to be added to my mailing list. I have to go in and do that all manually because I'm not that technologically savvy to have set up an automatic button yet. But if people are interested in learning more about any webinars or trainings that I have coming up, they can always email me or visit my website, which is morebehaviorconsulting.com, and they can contact me there. I also offer webinars privately to companies for continuing ed. So if a company wants to put on a training for all of their staff, I do that. We do those virtually, and we do them for sleep, for anxiety, and for functional analysis and treatment. And I also do private individual ones if people want that training, but their company doesn't want to do it, or they can't get it sponsored through their company, and I can offer continuing ed credits for any of those.
Great. So yeah, we'll put the links to your website and your email address right in our show notes for everyone, and so they can find you there.
And we're back. What an excellent interview.
Yes, that was good.
That was great. But before we talk about that, we wanted to take a little bit of time just to thank everybody that supports us and supports this podcast.
I just love all of the feedback we get and the people who are supporting us, especially those people who have left us reviews on Apple Podcasts or iTunes. And, there are people who comment on our Facebook and Instagram posts. And if you're ever interested, you can always email us at functionalrelationspodcast@gmail.com. If you have any questions, any comments, any praise or aversive stimulation. I mean, if you send us aversive stimulation, we're probably going to be a little anxious to open up our email inboxes, but feel free.
We like all sorts of feedback.
That's right.
But if you are interested in supporting us in more tangible ways, you can definitely go and check out Patreon because we're on there. And certainly our Patreon supporters are near and dear to our hearts.
Yep. Patreon is a website that allows listeners to access behind-the-scenes posts, bloopers, updates, and also we send out some small gifts to members to show our appreciation. You can learn more about becoming a Patreon member at www.patreon.com/functionalrelationspodcast. We're going to put a link in the show notes if anyone is interested. Caleb, one thing about Patreon members for this month, we have a merch store opening.
A merch store?
It's opening.
It's open?
It's open.
Is it open now?
It's open now. You could go there right now and get it. I mean, you could look at it. And Patreon members are getting a special discount code depending on their level of membership. So the loyal listeners are getting 30% off in our merch store. So
that's awesome. And what we have some t-shirts, right? Is that what we got for merch?
We got some t-shirts. Yeah, we got some t-shirts. We got some stickers. We got some magnets. We got some digital gift cards. If anyone wants to offer a gift to some BCBA that you feel like really deserves some extra appreciation, or maybe it's their birthday, or I don't know. And we also have some tote bags with our little logo on it, Caleb.
Very cool. Yeah, so people should definitely go check that out if you're interested in getting some functional relations merchandise. But let's talk about the interview.
Let's do that. All right. What did you think?
Great topic. I love it. It was very interesting. It's a little bit different, I think, than some of the other topics we've had.
It should be, because we would hate to do the same topic lots of times because that would get boring,
Right. So it was a good change of pace, I think, is what I'm trying to say.
Yeah.
Yep. But yeah, I think Dr. Moore's assessment methods for assessing anxiety for individuals with autism is pretty cool. So I know she mentioned this. She does give webinars on this topic. So certainly if people are interested in learning more about those assessment methods and more about anxiety in general, probably go check that out. I'm sure the content's pretty good. She seems to know quite a lot about things.
My wife, Angie, has actually taken the webinar on anxiety and she really liked it. So that's one of the reasons we had Dr. Moore come in, because we thought that there are probably other people who haven't heard about it that would also like it too. So I think one of the things that is really important to mention is that we didn't really go through the methods of what she does for her antecedent analysis. I mean, she has all of the details in the presentation and she has some handouts and things that you can get at the webinar. So I would go take a look at that if that's something you're interested in.
Zach, was there anything during the interview that kind of stuck out to you specifically, something that you maybe afterwards were just thinking about?
Yeah, I was kind of driving my car the other day and I was thinking, I really like how Dr. Moore mentioned about thinking about whether treatment is necessary for anxiety. So she gave that example of the birthday parties. What do you think the processes they went through to decide whether the birthday parties was something to treat or not?
So for me, when talking about this, it's easier for me to think about what are the things that are definitely necessary. Because I think probably like as you get towards like, I'm thinking of like a spectrum of things that are like completely unnecessary and should be 100% a choice. And then on the other side of the spectrum, there are the things that are 100% need to get done. Like, doesn't matter, got to get done. And then I think in the middle, it could probably be kind of messy. And then it may be probably a lot more to consider. So for me, it's easier to think about what are the definite necessary things. And what comes to mind are examples of like absolutely necessary, like medical procedures, like somebody's got like a toothache or something, or you identify like a really clear like medical issue that just needs to get resolved because it's causing like harm or pain to somebody. So in those cases,
just fell off the swing and broke your leg.
Yeah. It's like, I understand that going to the doctor causes a lot of anxiety, but we have to do it right now, right? It's like we can't just
Right.
let your leg be broken right now, or we can't let that
your bone is sticking out of your no.
So there's that end of the spectrum, which are things that if somebody has anxiety around going to the doctor or the dentist or getting some medical procedures done, maybe you want to address the anxiety around that, knowing that there's going to be times where that's going to have to happen, and we'd like somebody not to be really distressed during those times.
Yeah, absolutely. And then kind of the other things are just probably not that necessary. Maybe you can work on them. Like you said, there's probably some things that you'd want to work on because might increase someone's quality of life, right? So it's I don't like to go to the YMCA, but I do like playing basketball, but I hate the locker rooms, and I hate to.
Yeah.
It's all right, well, that's okay. We can go play basketball and we can we can use a little desensitization. We can use it for the locker room, but then we'll just go play basketball. It's fine. We can work on it slowly. So I think that makes sense to me. One of the things that you brought up that I thought was really smart, Caleb, you are so smart.
Thanks, Zach.
And I just wanted to let you know.
Thanks, Zach. Appreciate that.
You brought up how oftentimes people might try to disguise aversive stimulation. So they might kind of trick people into doing things.
So you're not talking, we haven't talked about this on the podcast. It's like you and I have just in the past had this discussion, right?
Yes. Yeah. This is kind of a long-standing discussion we haven't recorded before.
Right. Like the idea of somebody has anxiety around doing something. And so, and knowing that it's signaled, right? Because when we were talking to Dr. Moore, she said that anxiety is when an aversive event is signaled. And so when that signal comes around, you become very anxious around that, right? So that's where you get all that respondent behavior. Maybe you engage in some operant behavior, all that kind of stuff.
Yeah.
So yeah, something that I feel like I've seen is people to combat that will disguise the aversive stimulation or hide the signals, right?
Oh yeah. Right. It's kind of you're walking down the hallway, someone says, hey, yeah, let's take a walk out to the vending machine. And you get halfway down the hallway. And then the next thing you know, whisk away into the nurse's office. Wait, I'm in the nurse's office. Oh, I just got my shot. Oh, now we can go to the vending machine. Okay. Yeah. But basically in the end, that person was tricked into doing something. There were no signals in place that the nurse was coming or that the shot was going to be delivered. So is that what you mean?
Yeah. Yeah. And I think that...
Why is that a problem?
So in the short term, makes sense why people do it because it's probably effective, right? Going to use your example, Zach, right? Somebody doesn't like to go to the nurse. And so rather than saying, we need to go to the nurse's office now, it's necessary, and having somebody engage in all this behavior that's, described as anxiety, we don't say that. We don't give a signal, and instead, like you said, kind of it's disguised. While in the short term, that probably prevents anxiety, it may inadvertently, or at least, conceptually it makes sense, it may inadvertently kind of create some new signals, right? Making it unclear when aversive stimulation is coming. And so then maybe your example, then maybe every time you say you're going to the soda machine, there's always this chance that aversive stimulation is coming. And so
that's right.
You may, in the short term, reduce anxiety, but I have concerns of what that does in the long term. And you're huge on trust and building trust, which I think we all should. That's a really important thing. But trust, that's not a great way to have somebody trust you if you're disguising aversive stimulation. Hey everyone. If you've been listening to this whole episode and you're interested in getting a learning CE, the second and final code word is club. If you're trying to stay up to date on the literature, a good way to do that is to join a journal club. CLUB, club. When you finish this episode, head on over to functionalrelationspodcast.com to purchase your learning CE. Oh, and also, if you need ethics CEs, you can get 2 ethics CEs for any of our episodes from season 1.
Yeah. Yeah, my personal opinion is that we should be clear and upfront with someone about the situations that we're all in. So if we need to go to the nurse, I think we should clearly signal it. And the reason is that if we don't clearly signal it, like you said, other stimuli can become conditioned aversive stimuli. So now instead of just let's go to the nurse and all the stimuli that are correlated with that become aversive, now, like you said, maybe it's walking down that hallway toward the nurse's office, or maybe it's with the person who tricked me. Maybe they're going to trick me again, or maybe every time, like the vending machine, or maybe it's this particular time of day because it wasn't clearly signaled before. So now all these surrounding stimuli become conditioned aversive stimuli. And that makes someone anxious a lot of the day, or it can make them anxious throughout the day. And so I think that that's an important piece.
Yeah, and as behavior analysts, we know that like behavior generally isn't permanent, right? Like behavior is generally changing based on the environment. And so I'm going to tie this into one of Dr. Moore's examples. Remember, she was talking about the former client that had a lot of anxiety in the hour leading up to lunch. So
yes.
let's say that, lunch is at 1:00. And so from 12 to 1, that hour leading up, the clients may be engaging in a lot of anxious behavior. You may be able to move lunch from 1 to noon. So move it back an hour and you avoid in the short term all that anxiety. But because of what we know about behavior and we know what causes anxiety, presumably over time, that hour from like 11 to 12 is probably going to take on like the same anxiety inducing properties, right? So I think that
I think so.
It may be more beneficial to do things like counter conditioning, right? So you're keeping the same stimuli, but you're trying to change the function of those stimuli, right? So really kind of head on addressing the anxiety rather than just disguising it or doing things that in the long term probably aren't going to help or make significant changes.
Yeah. If we go back to the trust thing, I think that it's our responsibility to build trusting relationships with our clients. And when we are clearly signaling that we're going to start a desens program, this might cause a little anxiety. But one of the things about desensitization is that we're not going to push them too hard. We're going to make it a comfortable and successful treatment that works gradually. And so what we can do with desensitization, and this is why I use it so often, is because what we do with desensitization is that we're creating an opportunity for someone to gradually become less anxious about that context. But we're also, every single time that we have a successful trial or a successful experience with our clients, because they were able to complete at a reasonable step the desensitization program, we've built trust. So every single time we go there, we've shown them that you can trust me. I'm not going to push you too far. We're going to go a little bit and then we're going to be done for the day. And I think that that's how we build trust, and that's an important part of our relationship. And if we trick people, I just don't think that that is beneficial in the long run at all.
I was going to say, it kind of reminds me of a previous episode that we had with Pat Friman when they kind of helped a student overcome a phobia of, was it like insects or
something? Crickets, I think.
Yeah, and I'm pretty sure they came up with the protocol together, right? So it's like, So I think that kind of aligns with like making sure somebody is consenting to it, and when possible, working together to develop a program to help them overcome something that they want to overcome, right? So you're not just saying like,
great point.
You're not just saying like, we're going to do this like it or not. You're hopefully able to in some way explain why it's important that they overcome it. Hopefully they're consenting and they see the benefit it will have for them. And then you kind of kick off that desens program in a way that you're just describing, Zach.
Yeah. And so if you do have to use extinction and you have to get to that doctor's appointment, I guess the only recommendation I have is to be clear about it, to say, yeah, we have to go to the doctors. I know this is not fun, but we have to go because your bone is sticking out of your leg, Caleb. We have to go.
Yeah.
It's time. Yeah. So anyway, I think that this was a really cool episode, Caleb. What do you think?
Yeah, it was really helpful. Dr. Moore obviously knows a ton about this topic. So, obviously check out her webinars if you want to learn more. But I'm just really happy that she was able to come on and kind of share what she's learned about anxiety and how that can be used to improve the lives of the individuals that we work with. And maybe it also made you think a little bit about your own emotions or anxiety. I know with me, I kind of thought about things, how it pertains to me and like other people that I just interact with like on a day-to-day basis.
Yeah. We're going to put in the show notes Dr. Moore's email address so you can jump on her mailing list. And that way, whenever she has a new webinar, you can get an email to notify you. If you want to get a Learning CE for this episode, you can just go to our website at functionalrelationspodcast.com and get a Learning CE. Oh, and while you're there, check out our new merch store. You might be interested in some of that. And I think that's it, Caleb.
As always, Zach, it was a pleasure.
Yes, it was. Thank you very much, Caleb. We will see you guys next month.
See ya.